minutes. Let them confirm. Continue to share. 1 minute. Let me ask. So today we will do the liver pancreatic biliary surgery. Okay. So it is clearly audible and visible. Just type me in the chat box, yes, so that I can move forward. Yes, okay. So let us close this window. Otherwise, difficult for me to write. Just closing this window. Yeah. Okay. So first, the topic will be about your liver abscess. Okay. So moreover, all over the body, the abscess, if it's an internal organ, the most common organ will be your liver. Okay. So there is a abscess in the or the ulcers in the cecum also. Okay, so but more common, liver is the most common site for the abdominal visceral abscess. Whatever the viscera, that is lungs, liver, kidneys, the most common organ where the abscess is formed. This is your in the liver abscess. Okay, so there are basically two types. One is amoebic liver abscess and other is your pyogenic liver abscess. The one is pyogenic and the other is amoebic liver abscess. Okay. So just tell me one of the questions. What is the most commonest organism causing the pyogenic liver abscess? We know that what is abscess? It is a pus filled in the liver. Okay, that can develop from injury or anything. So just tell me, in pyogenic liver abscess, what is the most common organism? If anyone, you can search from the net or anything. Okay, Staphylococcus aureus. Yes. Okay, so A. Okay. So in this case, in pyogenic liver abscess, the most common organism, if they ask, your answer will be Escherichia coli. Okay. Staphylococcus aureus is also common, but it is usually most commonly seen in the children. Okay. So most common abscess, liver abscess, which is seen in the children, is usually due to the Staphylococcus aureus. Klebsiella pneumoniae, especially in adult cases, and Escherichia coli also in the adult, and Klebsiella pneumoniae, especially in the Western countries, the most common organism, whereas the Escherichia coli in the Asian countries. Okay. So here, that is pyogenic liver abscess is usually polymicrobial, that is so many bacteria are the cause of this diseases. The most common is your Escherichia coli. Sorry, E. coli. And but in Klebsiella pneumoniae, most commonly in the Western patient. Okay. 1 minute. I'm just this is for the, I am wrong. That is E. coli in the Western countries. Okay. And Klebsiella, it should be opposite. Okay. And Klebsiella pneumoniae in the Asian countries. Okay, remember this. Klebsiella pneumonia in the Asian countries and Escherichia coli in the Western countries. Okay, and what is the how the organism reaches into the liver? There are most common one is your through the biliary tract. It is the most common. That is the route of infection, and the second most common will be the portal vein. Okay, so you can go in here. The routes of infection in the pyogenic liver abscess. The biliary tract is most common. Among the biliary tract, the most common in the, if there is stones in the common bile duct, if there is CBD strictures, cholangiocarcinoma, especially seen in the Western countries, Portal vein is the second most common cause. So you should remember this. Biliary tract is the most common cause, and the second most common cause is the portal vein. Hepatic artery from the direct extension from these abscess, subdiaphragmatic abscess, empyema in the chest, blunt trauma due to the injury. Okay, so remember this chart. Okay, these are the route of infections in case of a pyogenic liver abscess. Now just tell me, what is the answer of this? What is the most common route of infection in the pyogenic liver abscess? What is the most common route of infection in the pyogenic liver abscess? Is it hematogenous spread through the hepatic artery? Is it direct extension from the adjacent organ? C, from the portal vein spread via the intra-abdominal infections or the trauma? Voice, is it for everyone that my voice is not coming? Okay. So Alicia, it is true, the most, your answer is that is the portal vein is the spread from the intra-abdominal infection. This is the second most common. The first is your, if there is some biliary tract, if there is some stone or the infection in the biliary tract. Okay. So remember this route of infections. Okay. Is this for everyone that my voice is not audible? I think Dr. Saroj, this is from your side only because everyone can hear. Okay, so let's move to the next point. Okay. Now, pyogenic liver abscess, its clinical features and the diagnosis. How will you? What is the most common clinical feature? The most common presenting symptoms will be the fever. Okay. And what is the most common liver function test in LFT abnormality? Okay. That is your raised alkaline phosphatase. ये one liner questions हैं. These are very important. Okay. These are very important. Now the classical triad will be fever, jaundice, and the right upper quadrant. Okay, let me. Is this MI? 1 minute. Dr. Saroj, I don't know whether it is problem from my side because let's see. Achha, I am not audible. You can speak so that I can hear. If you can unmute. Audible है ना?
हाँ मैम.
ओके, तो आई थिंक डॉक्टर सरोज वहां से कुछ आपको वहां से कुछ प्रॉब्लम होगा. ठीक है. ओके, सो जस्ट म्यूट योरसेल्फ. Okay, now let's move to the next part. Yeah, what is the classical triad for the most common symptom is fever. Obviously, if there is some abscess, there is an bile, there is information of like there is pain. If there is an abscess in the liver, there is pain and pain in the right upper quadrant and the jaundice. But the most common symptom will be the fever. Okay, and usually single abscess found in the right lobe of the liver. Liver abscess, it will be a poor prognosis only if it is associated with this underlying malignancy, jaundice, deranged LFT, and the sepsis. How will you diagnose the case? So obviously from the ultrasonography, and if there is a liver abscess, you have to go with the cytological examination. Okay. So the most common diagnosis test is your USG, followed by the CT scan, and to know which bacteria is causing, we have to do the like culture, that is aspiration and the culture. Okay. So whenever in the sometimes we can do the X-ray of the chest. Now suppose if there is an abscess in the liver and this is your lungs, what will we see that there may be elevated hemidiaphragm. Okay, so in the X-ray of the chest there will be elevated diaphragm. Okay. And sometimes atelectasis or the pleural effusion. Now just tell me, what is the most common presenting symptoms of the pyogenic liver abscess? Is it jaundice or right upper quadrant pain, fever, or the vomiting? Most common presenting symptoms of pyogenic liver abscess. Okay, so the answer is C. Very good. The most common presenting symptom is the pyogenic liver abscess. And if it is in the amoebic liver abscess, that is amoebiasis. If it is amoebic liver abscess, then the answer will be pain in the abdomen. Okay, so abdominal pain is the most common symptoms in case of amoebic liver abscess, and the fever is the most common symptom of the pyogenic liver abscess. Okay. Now, which liver function test is abnormal in most commonly seen in the pyogenic liver abscess? Reason, this can be asked as a reason and assertion question, or like match the following. Yes. So, everyone is right. So, it is your elevated alkaline phosphatase. Now, about the amoebic liver abscess. Okay. Now, here the causative organism is Entamoeba histolytica. Okay, this is important. In pyogenic liver abscess, the infection is via the portal vein, biliary tract. If there is stones through the hepatic artery, here the infection is mostly in the pico-oral route. And trophocyte reach the liver through the portal venous system. Usually, the amoebic liver abscess are the solitary and more in the right lobe of the liver, common in the young men, often associated with the alcohol consumption. Okay, this is all about your amoebic liver abscess. Now, what type of the ulcer you see in the amoebic liver abscess? If you see this picture, this is a flask-shaped ulcer. Okay, see the white base and it looks like a flask. Now, this flask-shaped ulcer is most commonly seen in the amoebic colitis or the liver amoebiasis, amoebic liver abscess, and most common site is in the cecum and the ascending colon. So they can ask where we can see the flask-shaped ulcer. Okay, and synchronized hepatic abscess in 1/3 of the patient. The most commonly seen, the patient who is suffering from your colitis, they are most likely to suffer from this liver abscess, that is amoebic liver abscess. And it is here the most common symptom is abdominal pain. Typically, patient is age about 20 to 40 years. Fever, chill, anorexia, right upper quadrant pain. Travel to the endemic area, and jaundice is rare. Remember, jaundice is more common in pyogenic and it is here rare. This is very important. So, yaad rakhna, dono mein difference. And what is the most common LFT abnormality? That is your waist prothrombin time. Most common diagnosis tool, same thing, ultrasonography. Then you have to go with the serological test to confirm the diagnosis. Here, if you do the aspiration test, that is, you will, there isn't one type of the appearance, that is anchovy paste appearance, a reddish brown color, other characteristics, okay? So this is very important. They can ask you anchovy paste is appearance is seen in which disease? Liver abscess, pyogenic, or the amoebic. They can ask you anything. Culture is usually sterile. Okay, even it is your enterohistolytica, the culture is usually sterile. So these are important pointers for the amoebic liver abscess. Okay. Now, most common complication is, suppose if the ulcer is enlarges, so it can rupture into the peritoneal cavity in the peritoneum. So rupture of the abscess and rupture into the peritoneum or in the pleural cavity. Okay, in the pleural cavity. Okay, so this is all about your amoebic liver abscess है, ठीक है? So remember the complications. The most common complications is rupture. Other rupture site is the pleural cavity, pericardium, and bronchi. The most common in the peritoneum. Okay. Large the abscess size, risk of the rupture is more. Okay. So this is very important. The complications. Now just tell me some of the few important MCQs. What are the causative organisms for amoebic liver abscess? It is, let me search E. Very good. Enta-amoebia histolytica. Most common lobe of the liver involved in the amoebic liver abscess. Where it is left lobe, quadrate lobe, right lobe, or the quadrate lobe. What is the most common lobe of the liver? The answer is right lobe of the liver. Okay, यहाँ पर भी right lobe ही होगा. So the answer is C, in the right lobe of the liver. Okay. Moving into the next questions. Most common liver function test abnormality in ALA is an ALA, not the pyogenic liver abscess. It is your amoebic liver abscess. Yes. The answer is raised prothrombin time. Alkaline phosphate raised in the pyogenic one, where the amoebic it is a raised prothrombin time. Sometimes it is normal also. Okay. Now, aspirated pus in amoebic liver abscess typically appears as green foul-smelling pus, reddish brown colorless anchovy paste pus, yellow purulent and chocolate-colored foul-smelling pus. Yes, it is your reddish brown odorless anchovy paste pus. Very good. So these are the some of the difference. Now come to the hydatid disease, the next topic about the liver pancreatic surgery. Okay. So what is the causative agent of the hydatid disease? It is your Echinococcus granulosus. Okay, so ये याद रखना, Echinococcus granulosus. There are others also, but the most common is Echinococcus granulosus. There is another one, Echinococcus multiocularis. Okay, multiocularis. This resulting in the malignant hydatid diseases. It is rare, but if it is there, it is more the causative organism will be Echinococcus multiocularis. So ये याद रखना. So Echinococcus granulosus, it is a tapeworm of the dog. So dog is an definitive host. Okay, so adult worm, it is present in the small intestine of the dog. Intermediate host are the sheep, goats, pigs, and the cattle. These are the intermediate host, whereas the humans are the accidental intermediate host. Remember, human to human transmission cannot occur. Human get this disease either from the dog or from the sheep, but no human to human transmission occurs. Okay, so remember, this is human is the accidental intermediate host, and the ships is the intermediate host, and the definitive host is the dogs. Okay, so this is basically it's the cycles. Life cycle is that the adult, the intestine in the adult worm is residing in the dog intestine, and this eggs in the feces, which is contaminate the environment. The ships eat this feces. Okay, and then when the human ingest or when they eat ships or the goats, they can direct intake the eggs, and that eggs were enters into the portal vein in the form of oncosphere and then enters into the liver and the lungs where they develop as an hydatid cyst. Okay. So in like CT scan, you will see a ring-like calcification. Okay, so they can ask the ring-like calcification in the CT scan is seen in the Hydatid's diseases. Usually Hydatid's disease, the patient, there will be no complaint. Most of the symptoms that they are asymptomatic. And sometimes if there is sometimes the patient complain of pain in the right hypochondriac region. So sometimes there is a pain, okay, and most commonly seen in the equally in the both male and the female. So male and the female have both common ratio. Most common site, if they ask, the most common site is the right lobe of the liver, okay, in the right lobe of the liver, especially in the quadrant number 7 and the quadrant 8. They are mostly asymptomatic. Sometimes they cause pain. Male and female equally, they are affected. Most common site is right lobe of the liver of quadrant number 7 and the 8. Okay. And what is the most common complications? The most common complications of the hydatid cyst, if it is enlarges, it ruptured in the biliary tree. Okay, the rupture of the hydatid cyst, most commonly in which side? In the biliary tree, that is in the right. So suppose if there is an abscess, so there is a right, the hepatic ducts are there, then common bile ducts, there may be ruptures in the biliary tree. So intrabiliary rupture is the most common complications of the hydatid cyst. In the ultrasonography, suppose if in the ultrasonography, what you will found in the ultrasonography is CT scan, they are the main diagnostic test. Here it is written as that is large cyst, and within the large cyst there is a small cyst. Okay, so this is known as your rosety appearance. Okay, rosety appearance in the ultrasonography. So rosety appearance means there is a large cyst and within the large cyst there are small dotted cysts. This looks like a rosety appearance in the ultrasonography. Okay, in the CT scan, this shows like a ring-like calcification. So ring-like calcification seen in hydatid's disease. Okay, so this is all about your hydatid's diseases. Now, actinomycosis of the liver. It is a rare form of actinomycosis. It's a chronic bacterial infection caused by a gram-positive anaerobic bacteria known as Actinomyces israelii. Okay, Actinomyces israelii, and they form a multiple abscess in the liver, not a single abscess. They form multiple abscess in the liver. So whenever there is a small, so many abscess in the liver, it looks like a honeycomb appearance. So liver looks like the honeycomb appearance. So sometimes it has asked if the honeycomb appearance is seen in which disease of the liver. That is actinomycosis of the liver. And how will you diagnose this? That is needle aspiration. Okay, in the needle aspiration, we will see that bacteria, the pus containing this bacteria. Okay, mode of the spread through the hematogenous spread from another site of the infections, direct extension, and from the portal vein also. Okay, so mode of spread to the liver. So this is all about your actinomycosis. Now come to the liver hemangioma. So it is the most common, if they ask you what is the most common benign tumor of the liver. Okay, so most common benign tumor of a liver is what? That is liver hemangioma. Okay, and most commonly seen in the women who are aged about 45 years. Mostly the hemangioma are single, less than 5 centimeter, most commonly in the right lobe of the liver. Okay, if the size is more than 5 centimeter, then it is known as giant hemangioma. Giant hemangioma. Now, what are the clinical features? That is, they are asymptomatic and accidentally diagnosed. Liver function test, that is LFT, liver function test, and the tumor markers are all normal. Okay, so and tumor markers are normal. Now come to the next question, next about your focal nodular hyperplasia. Now first, the most common is your hemangioma. The second most common benign tumor of the liver is focal nodular hyperplasia. This is second most common. Okay, benign non-neoplastic lesions of the liver, most commonly seen in the young women who are in the oral contraceptive uses. Okay, so it is the second most common, usually seen in the middle aged of the 20 to 50 years who are regular intake of the OCP. Okay, the gross feature, what you will see that it is usually a solitary, well circumscribed but non-encapsulated. Okay, doesn't have any covering or the capsule. So solitary, usually single. When you cut, you will see that weak spoke pattern. So this is very important. There is an central fibrous scar. A small scar is there with the radiating septa. Okay, a fibrous scar is there with the radiating septa. This is known as your weak spoke pattern. Okay, so this is all about your and focal hyperplasia. The most common clinical feature is sometimes the patient may complain of abdominal pain, whereas the liver function test is also normal. Okay, and diagnosis by the CT scan or the MRI. In the CT scan, what we will see a weak spoke pattern, that is a central, that is an scar, and it has some arteries which looks like a wheel spoke. Okay, so this is your in the pathology. Now come to the hepatic adenoma. Hepatic adenoma predominantly in the young women of 20 to 40 years. ये जो right है ना, इसको आप important करके रखो. Okay, strongly associated with oral contraceptive use, usually single, the multiple lesions may occur in 20 to 30% of the cases. Okay. Now pathology. Now this is very important. ये कभी कभी आपको like they can ask you among this which is true. So remember, in hepatic adenoma, they consist of small benign hepatocytes in cords. They contain glycogen and fat. In hepatic adenoma, there is no bile ducts, no fibrous septa, portal tract, and the central vein. Few or the no Kupffer cell, liver architecture is lost. So this is important in hepatic adenoma, that liver architecture is lost, whereas in other cases, that focal hyperplasia, hemangioma, there the liver architecture is not last, though it is also a benign type of the tumor. Okay, hemorrhage and necrosis are common in hepatic adenoma. Remember, in hepatic adenoma, in those cases, hemangioma and the FNH, the focal nodular hyperplasia, their malignant transmission doesn't occur, but in case of hepatic adenoma, they can transfer into the malignancy, but the chances are rare. Okay, the risk of transformation to the hepatic cell carcinoma is rare. And the major risk of the hepatic adenoma is rupture. Okay. So these are the clinical features of the hepatic adenoma. Symptomatic due to pain, and sometimes if there is an hemorrhage or due to compression, if the tumor compresses the other part of the adjacent organs. Okay, AFP levels are usually normal here. Remember, the tumor markers, that is AFP level is normal. Major risk is rupture or the malignant transformation, though they are rare. Okay, so these are important. Diagnosis by the MRI scan or the CT scan. Okay, so this is all about your hepatic adenoma. Okay. Now come to the, that is, what do you mean by the Wilson diseases? Okay. So Wilson disease is a autosomal recessive disease. This is due to the inherited copper disorder metabolism. Okay. So there is a disorder of the copper metabolism. So basically, in this case, the most common defect of the chromosome is 13q. The defective chromosome is, what is the most defect in the chromosome, that is 13q or the APTB gene. Okay, defect in the APT7B gene. 1 minute. I think, let me. Just give me some time. I think someone is calling. I need to close it down. Okay, just give me. So there is an increased copper level. Okay, increased copper level. Okay, increased urinary copper. There is a formation of a ring which is known as your Kerr-Fisher ring in the Leishman membrane of the cornea in case of Wilson disease, because there is a deposition of the copper in various parts of the body. If it is in the brain, it causes this neurological features such as tremor, Parkinsonism disease, temper, depressions. If it is in the eye, it forms a copper disposition in the site of the cornea, Kerr-Fisher ring. They are also resulting in the hemolytic anemia. Okay. So this is basically the mnemonic. Remember this. There is an S for the slit limb tract, other psychotic disorder, and the neurological sign. Okay, urinary copper is more than 100 milligram per deciliter, and these are the common symptoms. Okay, so so this is about your Wilson disease, and remember this is mnemonic of the Wilson disease. Okay. Yeah. Now come to the another one about your hepatic injury. उसके पहले आता है what is Courvoisier's law. If you see the diagram, now this is if there is an gallbladder obstructions. If in this diagram, if you see, there is a stone in the gallbladder and there is no stone in the gallbladder. The law states that in the presence of the jaundice, if there is a jaundice, if the gallbladder is palpable, that means the cause is not the stone. That is, the cause is mostly malignant. There is some obstruction in the path due to the pancreas, that is obstruction, or there is an cancer in the liver or the gallbladder or in the head of the pancreas. So Courvoisier's law states that in obstruction of the common bile duct due to stone, the gallbladder is basically, there is a chronic inflammation and the gallbladder is not distended, it becomes shrunken. If due to stone, the gallbladder is small and shrunken. If you palpate the gallbladder, this is due to the, if the gallbladder is palpable, that means there is an obstruction due to the cancer of the head of the pancreas or the duct or in the gallbladder. So this is known as your Courvoisier's law. Okay, so itna yaad rakhna. What is Courvoisier's law? When if the gallbladder is palpable, it is due to some cancer in the gallbladder or in the liver or in the cancer in the pancreas or the ampulla. Okay, but if it is not palpable, then the it is due to the stone. And here if the stone is present in the gallbladder becomes small and shrunken. If it is due to any cancer, the gallbladder enlarges and it is palpable. Okay, so this is all about your Courvoisier's law. Now, hepatic injury, the most common organ injured in the blunt trauma is spleen, followed by the liver. Okay, and the most common liver injuries, so most common liver injuries, what are the involved segment? That is 6, 7, and the 8 segment. Okay, the most common injured in the blunt trauma, spleen, followed by the liver. Okay, in penetrating abdominal injury, liver is one of the most third common injured organ. So this is in the blunt trauma, and if it is due to the penetrating trauma, okay, if it is in penetrating injury, then the liver is the third. Then the liver is the third most common. The first is your small bowel and the colon, so intestine. Okay, the most common in the small bowel, followed by the large intestine, the colon. Okay, and the third most common is the liver, if it is due to the penetrating injury. Otherwise, if it is blunt trauma, then the second most common organ which is injured is liver. The first is spleen. Okay, and is most common liver injury in which segment? 6, 7, and the 8 segment. Okay, we know that liver has dual, that is one is portal vein and through the hepatic artery. Okay, so most common liver injury bleeding is the venous. Okay, is the venous, that is black or sometimes bluish. The color of the blood will be the bluish. Now just tell me this one, in blunt abdominal trauma, which liver segment is the most common injured? Yes, it is your segment 7 and segment 8. Okay, yeah. So let's move to the another part, that is about your gallstones. So if you miss anything from the like this slide, just tell me in the chat box. So I will go into the site. Otherwise, I will move into the next part, that is about the gallstones. Okay, I will try to finish the liver pancreatic biliary surgery by today. Just give me a few minutes. So let's move to the next part. Okay. Now come to the gallstones. Okay. So what are the risk factor for the gallstone? We know that the mnemonic will be the four, that is fat, female, fertile, and the year is 40 age. These are the most remembered risk factor for the cholesterol of the for the risk factor for the gallstones. Okay. So based on the type of the stone, there are two types. The most common is cholesterol stone, and the second most common is your pigment stone. Now, pigment stone is again divided into the two type. One is your black, another is your brown stones. Okay. Now here, these are the risk factors. The female has more chance to develop the gallstone than that of the male. Obesity, middle-aged person who or the high BMI index, estrogen exposure, OCP, pregnancy in the hormone replacement therapy, if there is a rapid weight loss, the person is doing crash diet or the bariatric surgeries, family history, diabetes mellitus, prolonged fasting is also resulting in this type of the stones. Okay, so these are the risk factors for the cholesterol stones. Okay. Now, in case of pigment stone, there are again two types, black and the brown. The risk factor for the pigmented stone is your chronic hemolysis. So if the person is suffering from cirrhosis of the liver, they most likely to suffering from the pigment stone, the cirrhosis of the liver, chronic liver diseases, if there is an infections in the biliary tree, cholangitis, okay, old age or the biliary obstruction. So these are the pigmented, these are the cause for the both the black or the brown stones. So if you see this, basically one is cholesterol stone, which is most common. If they ask what is the most common stone, the cholesterol stone, then the pigmented stone, and then the mixed stones. Okay. Okay, now come to the different type of the gallbladder stone. Now come, that is black and the brown stones. Remember, we know that in cholesterol stone is more common, and usually what we know that the cholesterol is insoluble in water. Okay, we know that it's in fat, it is insoluble in the water. So there is and bile, basically the bile contains about 85% to 90% of the water. Bile also contains some bile acids and phospholipids. Okay, it also contains some bile acids and the phospholipids. Now, this bile acids and this phospholipids, these keep the cholesterol like Michelle. Michelle means your, what you say, for example, the soap. Okay. So this bile acid and phospholipids, they help the cholesterol not to be get deposit and to form a stone. Okay, so when the ratio is deranged, so when the cholesterol is increases and if there is a decrease in the bile acids and the phospholipids, so what happened? The cholesterol started to deposit and they form a crystals, which resulting into the cholesterol stones. So cholesterol stone is mostly due to the more than the increase in the cholesterol level in the body, it is due to the decrease of the bile acids and the phospholipids. Okay, so this is one of the main cause for the cholesterol stone, and these are the reason to resulting in increase this imbalances in the body. Okay, now yeah, so let's come to this one type of the gallstone. Now, black stones and the brown stones. And the black stone is made up of basically calcium phosphate and the calcium biocarbonate. ठीक है, तो इसको याद रखना. The composition of the black stone is your calcium phosphate and the calcium biocarbonate. Whereas the brown stone composition क्या है? That is calcium bilirubinate, calcium palmitate and the calcium stearate. Okay. Here The black stone, the common is your hemolytic disorder, cirrhosis, okay, cystic fibrosis, whereas these are the, if there is an infections in the biliary tract, okay, location in the biliary tract, or most commonly in the gram-negative bacteria. Location of the brown stones, mostly in the bile duct, where that of the black stones, it's mostly in the gallbladder only, okay. But here it is brown stone mostly in the bile duct and rare in the gallbladder. Okay, so these are the difference between the black stones and the brown stone. Obviously, here the, if it is here the this type of the stone is here the bile is infected because of the bacterial infections, but here if you the bile is not infected, the bile is sterile. Okay. Now come to the another part of acute cholecystitis. Whenever you go in the ultrasonography, you have seen that the patient is suffering from the cholelithiasis without cholecystitis. Okay, कभी कभी देखोगे ना आप लिखा है that is cholelithiasis, that means stone in the gallbladder with no inflammations. Okay, whenever there is an stone and there is an the gallbladder is inflamed, then it is known as your or cholecystitis. It's known as your cholecystitis. So cholecystitis is most commonly seen in those person who are suffering from the gallbladder stone. Okay, so more than 95% of the cases, the person who has a gallbladder stone, they suffer from the cholecystitis, or they will say the gallbladder attack, pain in the gallbladder region. Okay, so the classical triad will be the patient may complain of right upper quadrant pain, and there is a fever, and then leukocytosis, okay, and increase in the WBC, that is leukocytosis. Right upper quadrant pain, fever, increase of the WBC, and the leukocytosis. Okay, these are the characteristics triad of the acute cholecystitis. Okay, so whenever there is a suppose this is your liver, okay, there is biliary tree, right and the left hepatic duct. This is your common bile duct, and here is the liver. Okay, then it drains into the common bile duct. This is called a cystic duct. So whenever there is an obstruction in the cystic duct, now suppose if the gallstone goes and then it comes here in the cystic duct, then the patient may complain of sometimes of severe pain or the biliary colic. Okay. Now two type of sign, that is one is Murphy's sign and other is your Boas sign. Murphy's sign is that is inspiratory arrest. That is if you palpate the right upper quadrant and tell the patient to take a deep breath, he will feel pain in the right hypochondria. So this is known as your Murphy's sign. While the Boas sign is hyperesthesia and the ninth rib. Okay, Boas sign is your hyperesthesia. Okay, hyperesthesia below the right scapula, especially in the ninth rib. Okay, the T6 and the ninth. Okay, ninth rib. So Boas sign. Investigation of the choice, obviously the ultrasonography is usually the like investigation of the choice. Okay, so this is all about your acute cholecystitis. If you have any question, just type me in the chat box. अगर किसी को कुछ भी क्वेश्चन है तभी का तभी आप पूछ लेना, ठीक है? And if I'm going too fast, tell me if you need to pace my slow pace to be down, ठीक है? Okay. Let's move to the next part. Now about your gallstone ileus. So what is a gallstone ileus? Now suppose This is liver. Here is your gallbladder. Okay, cystic. This is Hartmann pouch. And then this is cystic duct, right and the left hepatic duct. This is a common bile duct, opens into the common bile duct, they goes down, okay, and then there is a channel, okay. This is your, now suppose gallstone ileus means the stone which comes down and enters into the intestine, and then they cause a mechanical obstruction, okay. Either they directly come from the stone, or they forms a fistulous opening, which is known as your polycystic enteric fistula. They biliary entered the form of fistula, and from that fistula, the stone enters and goes into the intestine and causes obstruction. Okay. The most common site of the fistula is between the gallbladder and the duodenum. Okay. So if they ask what is the most common site of fistula, that is, this is in between the gallbladder and the duodenum. Now this is the most common site, and the second most common site of fistula is gallbladder and the transverse colon. Gallbladder and the transverse colon. So these are one of the like good questions for the AIPGT, that is transverse colon. So whenever there is an obstruction, obviously the patient may complain of pain. Okay. So this is a triad which is known as your Rigler's triad. There is a small bowel obstruction, radiolucent gallstone. The gallstone is seen in the X-ray, especially in the intestine, and the pneumobilia. These three together is known as your gallstone ileus. Sorry, Rigler's triad. Okay. तो ये पूछा जा सकता है कि what is Rigler's triad and where you will find it. Okay, so Rigler's triad is basically that is formation of the, that is stone in the intestine, and it consists of that is pneumobilia, that is a presence of gas in the livers, in the biliary tree, or the gallbladder and the bile duct, and radiolucent stones and the small bowel obstructions. It's called as your Rigler's triad. Okay, so take it. Now let's move to the, so what are the clinical features? The clinical feature will be number 1, abdominal pain. Okay. So when a severe abdominal pain which resulting in the nausea and the vomiting. If they ask what is the most common site of obstructions of stone in the intestine, the most common site of obstruction by the stone in the intestine, then the answer will be ileum. Okay. The most common site is ileum, followed by the jejunum, followed by the, very rare, in the stomach. The most common site of in the ileum, jejunum, and the stomach, and then some part in the sigmoid colon. But the most common is in the ileum. This is most common site of obstruction by the stone. And how will you diagnose this? Obviously, the X-ray will show this thing: pneumonia, radiolucent stone, and the small bowel obstruction. Okay. Now, come to the, what do you mean by the Mirizi syndrome? So Mirizi syndrome, that is the gallstone which is impacted in the gallbladder or the neck or the Hartmann pouch, So suppose if it is there, it causes inflammation in the upper sides and also causes obstructions in the right and the left hepatic duct, that is in the common bile duct. So there is a backflow of the bile into the liver because the bile cannot enters, goes down through this pipe and enters into the liver because of these obstructions. So there is a distended common hepatic duct. So Mirizi syndrome is due to the gallstone impacted in the at the neck of the gallbladder or in the Hartmann pouch, resulting in obstruction or the erosion of the common duct. Okay, so this is called your Mirizi syndrome. Now, what do you mean by the strawberry gallbladder? Strawberry gallbladder, it refers to a cholesterolysis of the gallbladder, that is cholesterol, fats, esters, triglyceride. They accumulate in the gallbladder mucosa and give you a yellow appearance which resembles like that of a strawberry. Okay, which resembles like that of a strawberry. The yellow appearance, speckled yellow appearance due to the what? Cholesterolysis of the gallbladder. That means deposition of the cholesterol, esters, triglyceride, or your excessive accumulation of all these lipids in the gallbladder mucosa. So they are usually asymptomatic. Sometimes there is a dyspepsia or the biliary colic. Ultrasound, you will show that echogenic foci without shadowing. Okay. But in gross examination, you will see that the gallbladder looks like a strawberry. So this is known as your strawberry gallbladder. Okay. Now come to the polypoid lesions of the gallbladder or the gallbladder polyp. So they are basically benign polyp and one is your malignant polyp. Okay. So benign polyp are the cholesterol polyp. This is more common. Inflammatory polyps and the adenomas. So adenomas are basically your neoplastic polyps. So these are the malignant one. Okay, so these are the malignant one. बाकी जो ये दो है, these are benign in nature. So malignant polyp adenoma, or it is also known as your adenocarcinoma of the gallbladder, usually seen in the patient who are aged more than 60 years of age. Sometimes this type of the polyp coexistence with gallstones, and the gallstones are more than 10 millimeter in diameter. Okay, so these are the risk factor for the malignancy of the gallbladder polyp. Okay, so these are the risk factor for the malignancy of the gallbladder polyp. Size is more than 10 millimeter. Age should be more than 50. In some cases, it is more than 60 years of porcelain gallbladder or coexisting with that of the gallstones. And if there is a sudden rapid growth. Now, suppose if there is a gallbladder stone, which is about your 4 millimeter or your 7 or your 6 millimeter, 4 millimeter in diameter, and suddenly it started to increase its size in every 6 months, then it can be due to some risk in the malignancy, towards the malignancy. Sorry, not the stone, the polyp one. Okay, a sudden increase in the size of the polyp suddenly. Okay. So these are the some of the clinical features. They are usually asymptomatic.
मैम
Okay, may some yes.
मैम पोर्सिलिन गॉलब्लैडर क्या है?
Porcelain gallbladder, it's a deposition of the calciums and everything in a gallbladder. Okay, ऐसे कि मैंने पढ़ाया नहीं है ना porcelain gallbladder.
नो मैम.
Okay, ठीक है, वो I think वो आएगा एक के बाद एक के. It is there. Okay, it is there. Basically, if there is an excessive deposition of the calcium in the gallbladder, which is known, it looks like a porcelain in nature. That is why it is called porcelain gallbladder, and they are 90% associated with malignancy. I think it's अलग इसके बाद का वही टॉपिक है. ठीक है.
मैम पूछा जाता है कि मतलब गुड प्रोग्नोसिस विच मतलब कौन से गॉल ब्लैडर के, तो शायद ये पोर्सिलिन गॉल ब्लैडर का है ऑप्शन, मतलब गुड प्रोग्नोसिस के बेसिस पे।
Good prognosis are associated, 1 minute, huh? They have highly associated with the gallbladder adenocarcinoma. So it is not a good prognosis because adenocarcinoma of the gallbladder is not having good prognosis. ठीक है?
नो मैम, पोर्सिलिन गॉल ब्लैडर।
हाँ, बताओ क्या पूछ रही है पोर्सिलिन गॉलब्लैडर का?
मैम पोर्सिलिन गॉल ब्लैडर स्टोन जो होता है, इसका मतलब एक क्वेश्चन आया था कि इसका गुड प्रोग्नोसिस इज विच स्टोन ऑफ द गॉल ब्लैडर, तो ये पोर्सिलिन ऑप्शन था उसमें।
पोर्सिलिन इज 90% ऑफ द पोर्सिलिन, मैंने कहा ना कैल्शियम डिपॉजिट हो जाता है, ठीक है? ओके, एंड मोस्ट बट क्वेश्चन क्या था? व्हाट इज द क्वेश्चन एक्चुअली?
मैम मैंने
You can tell
वो
me the question, then I can tell. It is better. What's your name?
मैम प्रीति
हाँ
सिंह।
तो प्रीति, it is better that if you can you have my number.
यस मैम।
हाँ तो मुझे ना ये डायरेक्ट तुम पूछना इसमें, ठीक है? मेरे
ओके
व्हाट्सएप के मैसेज में पूछ देना, देन आई कैन एक्सप्लेन यू दैट टाइम। ओके
ओके मैम ओके।
ओके, चलो देन। Okay, so moving to the next part. Okay, so these are the clinical features for the polyp, and diagnosis by the ultrasound, and to know the morphology we have to go with the CT and the MRI scan. Okay, so what is porcelain gallbladder? It is gallbladder which has calcification of the gallbladder wall. Okay, so for this is your for Preeti. That is porcelain gallbladder is the calcification of the gallbladder wall resulting due to the chronic inflammation. So calcium salt deposition within the wall of the chronic inflamed gallbladder. Now, suppose a person is suffering from a stone, and every 1 year and every 8 to 9 months he is suffering from an gallbladder attack, which is known as acute cholecystitis. Okay, he is taking some medications and doing something, and the pain subsided. But if the stone remain and if there is a repeated attack, then sometimes it's resulting into the porcelain gallbladder. Okay, so porcelain gallbladder in most of the cases, 90% of the cases, they are associated with the gallbladder stone, and they have high frequency turn into the gallbladder adenocarcinoma. Okay. So usually seen in the age after 50 years of age. Okay, most commonly seen in the after 50 years of age. Now tell me the answer. Black pigment stones are commonly associated with biliary infections, hemolytic disorder, parasitic infections, or the biliary stasis. इसका आंसर क्या होगा? Just tell me the answer. Black pigment gallstones commonly associated with black tar and the brown pigment tar. The black is due to what reason, and the brown is due to the what reason? The black is a sterile bile, brown is your infected bile. I think now you can give me the answer. Yes, sir. So this is due to the hemolytic disorders. Now tell me this one, which of the gallbladder polyp has a high risk of malignancy? Yes, sir. So adenoma or the adenocarcinoma, basically they have, if it is more than 10 millimeter, they have then high risk of turning to the carcinoma of the gallbladder. Okay. So kuch risk factor hai. Let's start the what are the risk factor of the CA of the gallbladder. Okay. One is your gallbladder stone. If the stone is more than 3 centimeter, okay, but it has only 0.03% chance of turning into the malignancy. The second is porcelain gallbladder. Okay. The third is your adenoma. Okay. The third is your adenoma if it is more than 10 millimeter. Okay. Now, obesity is one of the cause, and if there is a person suffer from the repeated typhoid infections, so Salmonella typhi. Okay. So these are the some of the risk factor for the carcinoma of the gallbladder. Remember, incidence of the gallbladder carcinoma due to the gallbladder stone is only your 0.3 to 3%. And CA gallbladder has a poor prognosis. Okay. And most of the CA spread, if there is a carcinoma of the gallbladder, it most commonly metastasis is your adjacent organs. Okay, suppose the pancreas get affected, okay, the liver and then the stomach. So in this case, okay, so adjacent organs are affected. And in carcinoma of the gallbladder, in CA of the gallbladder, the most common site is the fundus. The fundus is the most common site, then the body and the neck. Okay. Now, tell me this answer. What is the porcelain gallbladder is associated with? Porcelain gallbladder is associated with, is it A, high risk of gallbladder carcinoma, cholesterol deposition in the mucosa, inflammatory polyp, and the always asymptomatic biliary colic? It is porcelain gallbladder has a high risk of gallbladder carcinoma. It's not a cholesterol deposition, it's a calcium deposition. Okay. So the answer is your, they have a high risk of the GB carcinoma. Okay. The answer is high risk of gallbladder carcinoma. Okay. So calcification of the bowel. Okay. The gallbladder wall. Now the choledocholitis cyst. ठीक है, this is about the bile duct. इसके बाद अगर pancreas रहा, we will finish the pancreas. ठीक है. So come to the bile duct. So choledocholycyst, this means your cystic dilatations of the biliary tract. This is biliary tree. Okay. Okay, right and the left hepatic duct, they join, they form a common hepatic duct. They join together, they form common bile duct, and this is a cystic duct. So this is normal architecture. Now, if see there is a cystic dilatation, there is some protrusion. So there are basically 5 type of the choledochol cyst. Okay, and the first one, if you see the type 1, there is a dilatation of the extrahepatic biliary tree. Okay, so there is a dilatation of the type 1 in the extrahepatic biliary tree. Not the intra one, not this one. Basically the extrahepatic biliary tree. In the type 2, there is some diverticular or the dilatation or formation of the diverticulum in the extrahepatic biliary tree. Okay, so this is type 2. And the type 3, this is cystic dilatation of the intraduodenal portion of the common bile duct. So now this enters into the duodenum. Okay, so it enters into the duodenum. So the dilatation, if it is here, then it is the type 3. Okay, now if the type 4, if you see that both the intrahepatic and the extrahepatic dilatation, this is your type 4. And in the type 5, only the intrahepatic dilatation. Okay, that's the reason in the type 5, there is a dilatation confined to the only the intrahepatic region. So this is known as your Caroli disease. Okay, so this is called your Caroli disease. Carolo disease means when there is a dilatation of only the intrahepatic duct. Okay, so the classical triad will be pain, jaundice, and the abdominal mass. And the most common symptom is your, especially most common symptoms in patient which is more than 2 years of age is abdominal pain. But in case of infant, it is the jaundice. So more than 2 years of age, the most common symptom is abdominal pain, and most common sign in infant is the jaundice. Okay, the investigation of the choice will be MRCP. Okay, so remember what are the complications of the cholangitis? This is the pneumonic. C for the cholangitis, recurrent infections to the bile, hepatic fibrosis. O for the obstructive jaundice, liver abscess. They have turned into the adenocarcinoma, gallstone or the bile surge, iatrogenic injury, and nutritional problem. Because obviously, if there isn't some inflammation intraduodenal portions, the enzymes which is presenting or they come from the bile or from the pancreas, they help in the digestion of the fat soluble vitamin. If it is cannot digest, then it resulting into the nutritional problems of the malabsorption. So ये pneumonic को याद रखना. These are the complications of the choledochal cyst. Okay. Okay, now let's move to the other point about your choledocholithiasis. That means that is if there is a stone in the common bile duct. Okay, cholelithiasis हो गया, cholecystitis हो गया. Choledocholithiasis means if there is a stone in the common bile duct. Okay, so right and the left hepatic duct, common hepatic duct. So when the cystic duct and hepatic duct join, resulting into the common bile duct. So if it's stone in the common bile duct, it is called choledocholithiasis. So there are basically two types. One is primary and another one is secondary. Okay, so primary is what? The primary stone is stone formed within the CBD, that is common bile duct. Okay, so right and the left hepatic duct, they join to form the common hepatic duct. Then this is your gallbladder. This is cystic duct. They join and they form your common bile duct. So primary means क्या है? यहाँ से the stone is formed in here only. But it's secondary. The stone form in the gallbladder and then it enters into the common bile duct. Okay, so this is the secondary cholelithiasis. Secondary जो stones होता है, these are mostly the cholesterol stones. Because most common stone in the gallbladder is cholesterol only. So this is your the cholesterol stone. Okay. और इसका जो stone होता है CBD, they are mostly the infected stone. Okay. So they are mostly the infected one. So this is all about your choledocholithiasis. Obviously, the clinical features will be the same. There is a pain in the right hypochondrial region due to the obstruction of the stone, and the patient always suffer from the jaundice, fever, and the abdominal pain. If the abdominal pain is very severe, then there is a nausea and the vomiting. Ultrasonography. The ultrasonography is the most common investigation of the choice. First test, they can show the gallbladder stone and also estimate the CBD diameter. Okay. Now suppose in a report, in the ultrasonography report, okay, आपने देखा in the USG में the bile duct is dilated. Okay, the bile duct is dilated, which is about more than 8 millimeter in diameter. Okay. A dilated bile duct, okay, with a gallstone and jaundice. Now suppose dilated bile duct hai, and also there is a gallstones and there is a jaundice also. Okay? Remember, then it is highly suggestive that that stone is in the common bile duct. So highly suggestive of choledocholithiasis. Okay. So if the patient is suffering from the jaundice, and if you go with the ultrasonography, the duct is dilated, the bile duct is dilated, and there is a stone in the gallbladder. That is some type of the stone is also present in the CBD duct. Okay, so this is a confirmatory sign of the choledocholithiasis. And to know, we have to go with the MRCP. Okay, so ultrasonography में आपको हो सकता है bile duct dilated दिखे, हो सकता है stone detect ना हो, but with the help of the MRCP, we can detect the stones. Okay. Okay. Yes, sir. Now come to the cholangitis. Okay. So can anybody answer this question? What is the classical triad of the acute cholangitis? Yes, it is your Charcot's triad. Can you just tell me where we can see the Murphy's triad? Can anybody tell me Murphy's triad हमें कहाँ देखने को मिलता है? In which disease we can, and what is Murphy's triad? If you can write in the chat box, what is Murphy's triad? अगर किसी को याद है, when we're studying during BHMS, yes, it is acute appendicitis, and the triad is pain in the right iliac fossa, vomiting, and the temperature. Very good, Alisha. So this is, here the answer is Charcot's triad. Okay. So Charcot's triad and the Reynolds pentad is the Charcot's triad along with the hypotension, confusion with the suppurative cholangitis. Okay. So what do you mean by the Charcot's triad? It is your abdominal pain plus jaundice plus fever. Okay, so this three together is known as your Charcot's triad. Along with that, if the patient is suffering from hypotension and the shock, then it is called your Reynolds pentad. Okay, usually seen in acute cholangitis. So this is your normal bile duct. When there is an inflammation of the and the scarring of the bile duct, this is called your cholangitis. And this is mainly due to some bacterial infections. Some bacteria, suppose E. coli, Klebsiella pneumoniae, this type of the bacteria, when they are present in the bile, they causes this inflammation and scarring of the or narrowing of the bile duct. This is called as a cholangitis. And the most common cause is that is stone in the common bile duct, that is choledocholithiasis. This is the most common cause for the cholangitis. In cholangitis, fever is the most consistent symptoms. Okay, it is the most consistent symptoms. So obviously fever ज़्यादा होगा. There is a decrease in the leukocyte count, WBC count increases. Okay, so these are the सबसे important है Charcot and the Reynolds pentad. Okay. Now come to this one. Addition of the hypotension and the altered sensorium to the Charcot triad forms what? Very easy to answer. अभी किया हम लोग ने. Yes, this is your Reynolds pentad. Okay. Gold standard diagnosis for cholangitis. It is your ERCP. Okay. Now, which of the following is not a feature of the Charcot's triad? Hypotension. Yes. Okay. Now come to the another part about your biliary atresia. Okay. So what do you mean by the biliary atresia? There is an destruction of the both extrahepatic duct or the intrahepatic duct. Okay. Destruction of the both extrahepatic duct or the intrahepatic duct. Okay. Usually due to there is an defect in the gene. Okay. Usually the most common, there is a defect in the gene. I think, yes. And this refers the newborn, they used to showing the sign of the jaundice within the 2 to 6 weeks of the life. Okay, so within the 2 to 6 weeks, they start to show the features of the jaundice after the birth. And biliary atresia, it is a most common indication for the liver transplantation. Yeah, okay, the liver transplantation in the pediatric patient. Okay, in the pediatric patient, it is the most common liver transplantation in the pediatric patient. Here, what happened? This bile duct proliferation. There is an uh, inflammations or that the formation of the strictures in the both the extra or the intrahepatic tract. Over the time, there is a fibrosis usually occurs and which resulting into the jaundice backflow of the bile into the liver and then it goes into the blood, which resulting into the jaundice. Okay. In the biliary atresia, what you will see that in the ultrasonography, as there is an no bile in the gallbladder. So gallbladder is shrunken and the common bile duct is not visible because it get shrunken or there is a formation of the small structures at the fibrosis. So CBD is also not visible. Okay. So this is basically USG of the liver and the GB is very important in biliary atresia. Okay. Now, okay, so what do you mean by the hemophilia? Refers to the hemorrhage into the biliary tract occurs when the disease or the trauma produced due to the abnormal communication between the blood vessels and the bile duct. Okay, so this is nothing, it is an hemorrhage from the bile duct. Okay, so hemophilia is the blood in the biliary tree, mainly due to the basically if there is an injury. Okay, resulting into the hemophilia. So bleeding into the biliary tract, and this is mostly a arterial source, intrahepatic arteries. So arterial hemophilia is the most common, and the most common cause for the hemophilia is your iatrogenic trauma. Okay, the most common is your iatrogenic trauma, followed by the blunt trauma, followed by the blunt trauma, followed by the penetrating injury. Okay. Hemophilia means blood in the biliary tree. Okay. So this is all about. Can you just tell me what is the most common cause of the hemophilia from these four options? Is it gallstones, blunt abdominal trauma, pancreatitis, or the viral hepatitis? It is blunt abdominal trauma. ठीक है? Okay. So this is one of the thing, that is your USG में triangular cord sign usually seen in the bilateral atrasia. ठीक है, ये याद रखना, the triangular cord sign is seen in where? It is seen in the bilateral, biliary atrasia. Okay. Now come to the next one. This is your pancreas division. Okay, अभी हम लोग खत्म कर देंगे. कितना बाकी है? Nothing is बस. Okay. We have timing. I think 20 minutes is there. So let's finish. So if you see this picture, ये क्या है? This is normal pancreas. Okay. This is your like normal pancreas. Okay, and it has main pancreatic duct. This is ventral duct and the dorsal duct, they together. In pancreas division, में what happened? This ventral and the dorsal duct, they cannot fuse with each other. So there are, this is called as your pancreas division. Okay, and it is a most common congenital anomaly of the pancreas. If the question asks what is the most common congenital anomaly, this is your the pancreas division. So here what happened, when the ventral duct and the dorsal duct, they fuse to join with each other. They do not join with each other like this. They fuse to join with each other. Then this is known as your pancreas division. Okay. So there are basically 1, 2, 3. So 1, 2, 3, 4 type of this. In the first type, if you see incomplete pancreas division, okay, there is some fusion is there, but it is incomplete. Complete pancreas division means no fusion in between the dorsal and the ventral duct. Reverse pancreas division means dorsal duct is here and the ventral duct, they change their position. Absent ventral duct, that is, there is an absence of the ventral duct. So basically, there are 4 type of the pancreas division. Okay, type 1, type 2, and the type 3, and the type 4. And the investigation of the choice is MRCP, magnetic resonance cholangiography. Okay, something like this. Can you just tell me what is the most common congenital anomaly of the pancreas? Quickly. Most common congenital anomaly of the pancreas is pancreas division. Yes. Now come to the annular pancreas. The annular pancreas, you see that there is a fibrous ring is seen in the second part of the duodenum. Okay. So this is known as an annular pancreas. A ring of the pancreatic tissues completely encircles the duodenum. It is most commonly associated with the duodenal stenosis or the atrasia. Diagnosis by the ERCP. ठीक है? And most commonly where this annular pancreas, it is in the second part of the duodenum. ये important है, the second part, which location? In the second part of the duodenum. And annular pancreas, it is also associated with the duodenal atrasia of stenosis and also with the Down syndrome. Okay, associated with the Down syndrome. Okay, now come to the acute pancreatitis. इतना याद रखना, what is the common causes of the acute pancreatitis? The most common is your gallstone, followed by the alcohol. And these are some of the other causes. Okay. So these are some of the causes of trauma, pancreas division. The most is your stones, gallstones, then the alcohol. Okay. The most common clinical feature is upper abdominal pain and which is going into back. Okay. So acute pancreatitis का जो clinical feature होता है, the patient will come to you with a pain in the epigastric region. Okay. And this pain is radiating in the back. So very important है, pain in the epigastric region, which is, or the umbilical pain, which is going radiating into the back, and the pain is very much constant. All the features of the colosynth, you will mean how the patient will get relief by bending downwards with a pillow, okay, in the abdomen. So this is a feature for the acute pancreatitis. Okay, and the epigastric, and there is some epigastric tenderness. And there are few signs. Cullen sign is if there is a bluish discoloration in the umbilicus, around the umbilical region. This is known as your because it's in retroperitoneal hemorrhage, it's known Cullen sign. And if it is in the flank, that bluish discoloration, this is known as your Turner sign. Okay, this is called your Turner sign. Another, if there is an Fox sign, that is ecchymosis, if it is seen in the inguinal region, then it is called as your Fox sign. Okay, so about this are the clinical feature. And in the pancreatic enzyme, we know that the pancreas, it secretes your serum lipase, serum amylase, which help in the absorptions and the digestions of the fat-soluble vitamins and the fat. Here, what you will see in acute pancreatitis, there is an increase in the pancreatic enzyme. Okay, increase in the serum lipase and the serum lipase and the serum amylase. But in acute pancreatitis, lipase is more specific in acute pancreatitis than that of the amylase, because amylase has a short half, it has a shorter, it says a half life is shorter. Okay, it's a half life is shorter than that of the lipase. So lipase is more specific in acute pancreatitis. Okay, also most common investigation of the choice is your the CT scan. If they ask what is the investigation of the choice for the pancreatitis, your answer will be your CT scan. Okay, ये बहुत important है. I think it has been come in the year of 2024 to 25 में. What are the Ranson criteria for the pancreatitis? Okay, so you should have to notice this. These are the evaluation on the admission before and after the 48-hour to assessment of the severity of the acute pancreatitis. To assess the severity of the acute pancreatitis, Ranson criteria is useful. Okay, so ये याद रखना. These are the evaluate on admission and in 48 hours after the admissions. Okay. Age should be 55 years. WBC count is more than 16 during admission. Okay, and glucose should be more than 200, LDH should be more than 350. This is of the Ranson criteria. And you can, this is basically the how do you mnemonic. So just remember this. G for the glucose more than 200, A for the age more than 55, at admission GALO. Okay, this is a mnemonic for the Ranson criteria during the time of the admission. So these are the criteria for that. L for the LDH, A for the AST or SGOT. Okay, so ये आपको, you just click this one. This is a mnemonic for the Ranson criteria at the time of admission. And this is after 48 hours. जब admission हो गया, the mnemonic will be CHOPS. Calcium should be less than 8.0. Okay. मिलीग्राम पर DL. हेमोटोक्रिट वैल्यू. O for oxygen कितना रहना चाहिए, base deficit कितना रहना चाहिए. So the mnemonic will be CHOPS. Okay, तो ये याद रखना. One is GALO and this last slide. Okay, so this is the last slide. So modified Glasgow criteria, it applies to both the gallstones and the alcoholic pancreatitis, best assessed within the 48 hours of the admission. It's also known as your Emery scores. Okay. So this is your modified Glasgow criteria. ठीक है, और इसका है pneumonic should be pancreas. ठीक है. This is the, I think, wait, age, yeah. So these are the modified Glasgow criteria. ये अभी तक आया नहीं है, but yeah, this about the Ranson criteria, they have asked you MCQ question in the last year, I think. Okay. So these are the, what is the modified Glasgow criteria is used for? This is applies for the both gallstone and alcoholic pancreatitis for to assess the patient after the 48 hours of the admission. So these are the what should be taken, that P for the PA, A to A for the age should be more than 55 years. Neutrophil count कितना होना चाहिए, calcium. So remember this, the pneumonic है, याद रखना. Okay. This is, and this is also the cutoff value is also very important. More than this is important. Okay. Now these are the complications of the acute pancreatitis. Okay, there is an pseudocyst, formation of infections, hemorrhage, pancreatic abscess, pancreatic fistula, repeated acute pancreatitis resulting into the chronic pancreatitis, vascular में portal vein thrombosis or the autopancreatic fistula. Okay, in case of vascular and portal vein thrombosis, and also if there is some vascular thrombosis, the most common actually vein will be the splenic vein, followed by the portal vein. Okay. So vascular complications of the acute pancreatitis, most affected vessel is your splenic vein. In severe cases, it extends into the portal venous system. So there is a spontaneous rupture resulting into the massive bleeding. In case of, if the complications, if there is a thrombosis in the splenic vein. Okay. Now pseudo pancreatic cyst, obviously there is a formation of the cyst in the pancreas. This is one of the common cause for the acute pancreatitis, like common complications of the acute pancreatitis. So most common causes alcohol and also the acute pancreatitis, repeated acute pancreatitis in case of, or the patient is suffering from the chronic pancreatitis. Okay. So yes, sir. This is nothing, formation of the stones in the carbonate of the crystals. You will see in the chronic pancreatitis. The clinical features of the acute and the chronic pancreatitis is the same. ठीक है? Epigastric tenderness going towards the back. So if the person is suffering from the repeated acute pancreatitis, they goes into the chronic pancreatitis and there is an inflammation, and afterwards there is a fibrosis of this pancreatic tissues or pancreatic parenchyma, which resulting into the chronic pain. And pancreas contains both the endocrine, that is, and the exocrine efficiency. So for example, the patient may suffer from the irritable malabsorption syndrome. Okay. If acute pancreatitis is a feature of hyperglycemia, you can see other than the feature, classical triad will be your, if there is a malabsorption syndrome, there is a steatorrhea. Okay. That is your fatty stool along with the pancreatic calcification, which resulting into hyperglycemia. Okay. So the important is your, I think this one, the imaging studies. If you see the images, the CT scan, you will see that this type of the calcification. The X-ray and the CT scan may shows calcification. And here in pancreatitis, one of the pancreatitis dilated, and then there is a stricture. Again, some of the pancreatic duct is dilated. Again, then there is some stricture. So this type of the pancreatic intestinal strictures you can find in the CT scan or the X-ray imaging. Okay. Okay. Another thing, I just missed it. Sometimes, this is also called as your chain of lake appearance. ठीक है? ये एक है chain of lake appearance when there is a dilatation and the stricture, again dilatation and the strictures. This called as a chain of a lake appearance. Okay, and ERCP basically a gold standard diagnosis for the chronic pancreatitis. So this is all about of rather than this. So if you see this Whipple procedure का मतलब क्या है? Sometimes they can ask you what do you mean by the Whipple's procedure. The Whipple procedure is this is the normal. Okay. Now if there is an what we say, if there is an gastrojejunostomy, the pancreojejunostomy and the cholangiostomy, these three together, if procedure is confirmed, then it's known as your Whipple procedure. Just give me some time. So, ओके, इससे पहले वाला मतलब देव प्रसाद चौधरी, मुझे समझ में नहीं आया. चलो, let's move to the yes, the Whipple procedure. And if you see, they remove the head of the pancreas. Okay, so they remove this one is removal of the head of the pancreas, removal of the first part of the duodenum. So Whipple procedure is the removal of the number 1 head of the pancreas, removal of the first part of duodenum, okay, or in some first part of the, sometimes the first part of the small intestine. If you see there is a no gallbladder, so also the removal of the gallbladder and the bile duct, okay. So cholecystojejunostomy, pancreajejunostomy, and the gastrojejunostomy, and there is a passage, they have two. This is known as your Whipple procedure. In Whipple procedure, they remove the gallbladder and the bile duct. They removal the duodenum, first part of the duodenum and some part of the small intestine also, and then they get a channel from the stomach to that directly to the intestine. Okay, and then they also remove the head of the pancreas. So this is called your Whipple procedure. Okay, this is called your the Whipple procedure. Okay, so this is all about right now. इसके बाद something is still remaining about the neuroendocrine tumor of the pancreas. And yeah, if they ask about the carcinoma of the pancreas, okay? So I'm just writing it here. If they ask you about the carcinoma of the pancreas, the carcinoma of the pancreas, the most common site for the carcinoma of the pancreas is the head, okay? Followed by the body, followed by the body, followed by the tail. The head, body, and the tail. The most common site is your head. And the most common type is adenocarcinoma. Okay. Most common is your adenocarcinoma. What is the tumor marker for the CA of the pancreas? CA19 and the 9 is a tumor marker for the CA pancreas. Most common symptoms, obviously, if there is an pain in the abdomen, a chronic pain in the abdomen, okay, which is radiating to the back, as there is no enzyme to digest fat, so malabsorption, which resulting in the weight loss. Okay, and I told you that is what I about the Corvaser's law. If there is an if there is a tumor in the pancreas, head of the pancreas, the gallbladder is palpable and large. That is gallbladder is palpable. Sometimes, if the cancer spread, if in the left supraclavicular group of lymph node, then it is called as a varicose nodes. Okay. Or sometimes if the tumor is in the along the metastasis in the about the lymph node in the umbilicus, then it is known as your Sister Mary Joseph nodules. Okay. Mary Joseph nodules. This you will see in the carcinoma of the head of the pancreas. Okay. If it is spread in the, carcinoma of the pancreas, if there is a lymph node enlargement in the supraclavicular region, and there is a enlargement in the umbilical region, which is known as a Sister Mary Joseph nodules. Okay. So this is all about your chronic pancreatitis. Other than this, weight loss, and obviously if there is a jaundice, there is an increase of the bile acid, which causes itching of the skin itching. All the features of the jaundice is also present in CA pancreas. The features of the chronic pancreatitis is also found in the CA pancreas. If there is an enlargement of the lymph node, supraclavicular group of the lymph node, which is known as your varicose nodes, and if there is a lymph node enlargement in the umbilical region, which is called your Sister Mary Joseph nodules. Okay. So अभी तक इतना ही करते हैं. In the next part, we will start with the GIT section. Some of the neuroendocrine tumor is still remaining. We will do in the later, like in the next class. ठीक है. और के बाद, so if you have any slide missed, just let me know. तो वो मैं आपको दिखा दूंगी. ठीक है. And sorry, I think yeah. हाँ. So thank you everyone. आज and if you have any questions regarding the GIT, आप डायरेक्ट डॉक्टर नाजरा या डॉक्टर ताहा को पूछ सकते हो, या मेरा नंबर अगर आपके पास है, यू कैन आस्क मी डायरेक्टली इन माय व्हाट्सएप. ओके. So thank you everyone. Chalo then. Next class, maybe not this Saturday or Sunday. It will be in the next Saturday and the Sunday. Okay. And that.
मैम कुछ स्लाइड मिस हुआ है, वो एक बार दिखा सकते हैं?
कौन सा स्लाइड?
मैम इसमें एक्यूट पैनक्रेटाइटिस में.
एक्यूट पैनक्रेटाइटिस में. ओके. आप मुझे बताते जाए ना. जस्ट मूविंग माय स्लाइड. ओके. एन्युलर पैनक्रेटाइटिस, टर्नर, ये वाला स्लाइड.
यस मैम, यस. ये इससे पहले ये वाला और इससे पहले वाला. एक सेकंड के लिए. ओके मैम, ये हो गया.
ओके. दिस वन.
हाँ हाँ एक सेकेंड। हाँ मैम।
ओके ओके।
हाँ
तो
हाँ
ये वाला, दिस न्यूमोनिक याद रखना, बाकी आई थिंक विल गेट इट फ्रॉम योर बुक्स ऑल्सो, बिकॉज ये नहीं मिलने वाला, ठीक है। चॉप्स, कैल्शियम, एचसीटी, हेमाटोक्रिट फॉल, लगा ले। नेक्स्ट नेक्स्ट स्लाइड। या और कुछ?
मैम फर्स्ट एकदम स्टार्टिंग में
एक्यूट पैनक्रियाटाइटिस का या एकदम स्टार्टिंग में जैसे क्लास शुरू हुआ था?
मैम लीवर एब्सेस।
लीवर एब्सेस, ओके। आपके फोटो क्लिक कर लेते हो क्या इसके, पिक्चर्स
यस
वगैरह? ओके। टिक टिनोमाइकोसिस। अच्छा ये वाला,
इससे और पहले है मैम।
से ये वाला, यस, ये और उससे पहले ये क्वेश्चन यहाँ से शुरू होता है, ठीक है। फिर
मैम फिर ये
हाँ,
एक क्वेश्चन था कि जो पायोजेनिक लीवर एब्सेस है तो इसमें मोस्ट कॉमन ऑर्गेनिज्म अगर आता है तो क्या लगाएंगे, इकोलाई की क्लेबिसिला?
ईस्टर्न एंड दी वेस्टर्न कंट्रीज में ना, है ना, तो हम लोग एशियंस में रहते हैं ना, तो तुम एशियन कंट्रीज का ही डाल देना एक्चुअली।
तो इकोलाई रहेगा कि क्लेबिसिला रहेगा
नहीं नहीं,
मोस्ट
अगर
कॉमन?
वहां पर अगर एशियन कंट्रीज और वेस्टर्न कंट्रीज बोला है तो उस हिसाब से तुम दे देना, ठीक है। अगर नहीं बोला है तो इस तरह कोली दे देना, इकोलाई,
ओके
ठीक
ओके
है।
ठीक है ठीक।
हो गया? एनीथिंग? चलो, और एनी स्लाइड यू वांटेड टू सी? नो, सो शैल वी?
मैम हाइड्रेटेड सिस्ट का टाइप में एक
आपकी आवाज क्लियर
टाइप
नहीं है,
नंबर
आपकी
थ्री
आवाज ब्रेक
था
हो रही है, आपकी
वो
आवाज ब्रेक हो रही है, मुझे सुनाई नहीं दे रहा है। आप चैट में लिख दो क्योंकि आपकी आवाज ब्रेक हो रही है।
हाइड्रेटेड सिस्ट।
हाइड्रेटेड सिस्ट है ना, हाइड्रेटेड सिस्ट, ये मल्टिक लीवर एक्सेस, ये वाला हाइड्रेटेड सिस्ट।
टाइप।
हो गया? ओके, एनीथिंग?
नेक्स्ट स्लाइड।
नेक्स्ट स्लाइड।
मैं दो स्लाइड नहीं
इंटरमीडिएट
नहीं
कोर्स,
मैम,
ये
इसके
वाला।
दो स्लाइड पीछे।
आपकी आवाज ना बहुत ब्रेक हो
और
रही है, से बेटर कि अगर आप
मतलब
लिखो। मुझे सुनाई नहीं दे रहा है आपकी आवाज, आपकी बहुत ब्रेक हो रही है, आप मुझे लिखो, वहां पे लिख के भेज दो, बोलने से
हेलो।
अच्छा है। हाँ, आपकी आवाज बहुत ब्रेक हो रही है इसीलिए। टाइप, किसका टाइप? कौन सा टाइप? चलिए, एनीथिंग? देव प्रसाद चौधरी, आपकी आवाज इतनी ब्रेक हो रही है, मुझे सुनाई भी ठीक से नहीं दे रहा था एक्चुअली।
मैम कोलोडोकोसिस्ट का
कोलिडोकोलिसल सिस्ट का टाइप है ना, विल्सन डिजीज गया, फैक्टर्स, acute cholecystitis, saline, yes, this is the type 1, type 2। ये डायग्राम से भी याद रखना, दिस इज एक्स्ट्रा हेपाटिक, there is some diverticulum in the extra hepatic, and here just in the duodenum part, okay. Here both the intra and the extra hepatic, and in type 5 only the intrahepatic, which is called as Caroli's disease।
मैम टाइप 3 ड्यूodenum के अंदर होता है क्या?
हाँ, ड्यूडोनियम और उसके
टाइप 3।
जस्ट एंट्री में, उसके एंट्री में, ओके, टाइप 3।
ओके।
तो तो वो ड्राइंग से भी याद कर लो, और बाकी का तो जब क्वेश्चंस आएंगे, बाकी का अगर नहीं भी आता तो बाकी का ऑप्शन से वो आपको आ जाएगा, क्योंकि ऐसे ही होता है उतना, जब नहीं होता है तो वो हम लोग इस तरह से याद करते हैं। ये हो गया कोलेडोकोसिस्ट। और कुछ हो गया? So shall we wind it up for today? Next class will be on Sunday, next to next Sunday, okay, not this Sunday. ठीक है? So GIT शुरू करेंगे, and some neuroendocrine tumor of the pancreas रखा होगा. Okay, so thank you everyone then. चलो